Hi there, it's Kathy again, and welcome to this episode of Reclaiming Your Health, the short video that looks at while the system is collapsing all around us, it's time to take back our responsibility for our own well being. For decades, we've been told that our healthcare system is the best and it exists to protect our health. Yet here we are, 2025, late 2025, and it is painfully clear the system is buckling under its own weight of soaring costs, political short-term fixes, and a design that's built more around crisis intervention than lasting wellness. Programs such as the Medicare Part D, which is the prescription drug benefit passed in 2006, and the Affordable Care Act, also known as Obamacare, passed in 2010, were introduced to expand access, a notable goal. But they both lacked sustainable funding models. It's great to have it, but how are we going to pay for it? Meanwhile, expansions of programs like Medicaid, these programs just serve more as band-aids being stretched and pulled until they break rather than structural solutions. So what's the result? Well, we have a system where many people cannot afford the care that this system was designed to provide. And therefore, taxpayers are ponied up to continuously subsidize insurance models that never, ever fixed the root problems. So in this environment, waiting for the system to redeem itself is not a viable strategy. It is not. Each one of us, have to reclaim our own health and our own well-being from the inside out. We don't control every aspect and maybe any aspect of policy or cost sometimes, but we absolutely can take back control of our daily habits, our care networks, our communities. 30 years ago, I established a working care model that looked at 10 different domains of health and well-being as we age. And about 10 years ago, I realized that our healthcare system just wasn't the model and no longer designed to keep us healthy. In fact, it's designed to keep itself alive. This awakening pushed me to step out of the system's grip and begin rebuilding my own foundation for health, my own foundation for self-awareness, for prevention, and for community. So I revised this model, and I spent the last 10 years teaching others how to do the same, how to reclaim their power, teaching others how to be there for themselves and how to reduce their dependencies on this broken system and rediscover how to push back and what true well-being really means. So together, we're proving that health can be reclaimed, and we can do it one person at a time from the inside out. So I'd like to share 5 evidence-based, which means they have science behind them. It's not just some crackpot on social media that you can take right now. So, excuse me, let's look at the first one. Return to the basics of self-health, care of the self. If the heart, how do I say this? Reclaiming your health is an understanding that so many of our chronic conditions and illnesses are preventable. And yet the system, the broken system, continues to treat aging as a disease, illnesses as bits and pieces to either provide medications for or treat individually rather than help us prevent it. Research indicates there's plenty of research out there. Lifestyle medicine interventions such as healthy eating, some type of physical activity, adequate sleep, stress reduction, reduces our risk of obesity, type 2 diabetes, hypertension, vascular disease, all this, and even including cancer. Just look at pictures of people in the 70s compared to the same pictures of groups today. And there is a huge difference. A multi-cohort study found that individuals, that's you and me, who followed a combination of healthy lifestyle behaviors gained an extra 9 to 10 years, free of major chronic diseases than people with poor lifestyle profiles. So what are the high impact bases to restore? What is it? It's wonderful to say sleep, diet, exercise. So sleep, let's look at that. Adults generally need 7 to 9 hours per night. In fact, chronic sleep deprivation or irregular patterns of sleep are increasingly linked to metabolic dysfunction, hypertension, inflammation, all the things that add and create chronic illness. The next is hydration and whole foods. Emphasize minimally processed foods, vegetables, fruits, whole grains, legumes, in fact, anything that's not in a box. Minimize adding sugar and saturated fats. Think of the diets that existed in the 60s. We did most of our own cooking then. Go back to the basics. It's cheaper, it's better for you. The next is movement. Consistent physical activities reduces lipid profiles, blood pressure, sugar or glucose control, and has been shown to delay onset of chronic illnesses. Mental stillness for stress management. Chronic stress just pours the cortisol through the body, which increases inflammation, undermines sleep, reduces immunity, and therefore reduces your own resilience. So incorporating free and simple practices such as meditation. Start with 5 minutes a day and work up. It helps. Mindfulness, downtime. Take it. It's foundational. Avoid toxic habits. We know this. Alcohol use, tobacco use, high levels of sedentary behavior remain among the most modifiable risk factors for chronic illness. And this is an individual decision. If you're having trouble, there are resources available in communities to help. So by focusing on your daily habits here, you shift from being a system recipient to the architect of your own health. And therefore, the healthcare system becomes your backup, not your foundation. Let's look at the second area in building a personal care network. What do I mean by that? So as our healthcare systems collapse and become or have been more complex, the most meaningful care that happens for all of us is in micro networks, local physicians. It's relational, it's transparent, it's person-centered. So how do you set up your own ecosystem, right? That gives you more autonomy and basic alignment with who you are. So let's look at a couple of those steps. Build or choose or find or stay with a trusted, keyword here, trusted primary care provider, a PCP, nurse practitioner who spends time understanding you, the person, and not just your labs or insurance codes. Find a local pharmacist that you trust, someone who answers questions, checks drugs interactions, acts as an advocate for you, not just a dispenser. This is an underused, valuable resource. I use it all the time when I have questions. Incorporate complementary, holistic providers. A lot of insurances have benefits for fitness, for weight reduction. Think about nutritionists, physical therapists, massage, acupuncture. These support preventative and functional well-being. They make you feel better, not just prevent disease. Engage in your own support circle. Who are the people who show up in your life? Your family, your friends, your community members, or just one of these groups who can help act as a health advocate, help you navigate referrals, help you track changes over time, and more so keep you accountable. Get a walking buddy. Consider membership-based or direct pay clinics that offer transparent prices and fewer bureaucratic layers. And it commits to your better health through relationship building. And why does this matter? I don't have to tell you this. Traditional systems struggle with personalization. The system sees you as a claim, puts you in a risk category, not a dynamic person with a history, preferences, network, and I don't mean in-network for insurance. I mean my network that I run in. By creating my own network, it gives me agency and reduces dependence on expensive, crisis-driven care. I don't victimize myself. Yes, I do have an advantage. I am an RN, so I know how to work around the system. But you do not need that to help somebody out or to ask somebody to help you. There's a big one, the next one. Take financial ownership of your choices. You know, finances in healthcare isn't just about can I afford insurance? It's why care is so costly in the first place. Let's look at that. According to the latest data, half, 50% of all you adults in the United States cannot afford healthcare costs. 25% say that a family member had trouble paying for care in the past year. You know, health insurance does not guarantee affordability. In fact, it just adds another layer in many kinds of ways. Even those with coverage skip needed care because of the copays, the coinsurance, and the added cost. So what can you do? The first thing, the very important thing, and thing I've been doing for decades, is to assemble your own health and aging blueprint. Look at your own risk areas in terms of insurance, finance, housing, health, estate plan, local services. You need to have some idea of where you're going in life, or any road will get you there. So build this. I'm going to be doing a video on how to do that within the next couple of weeks. Next is to look at the transparent care options. Direct pay clinics, telehealth subscriptions, local communities offer sometimes flat fee memberships or pay per visit model. This eliminates opaque billing and actually may cost you less. This is true with medications. You know, there are a lot of discounts such as GoodRx, Single Care, where you can buy medications cheaper than using your insurance. Next, understand every dollar. Ask your physicians, your healthcare providers, for cost breakdowns and whether these tests or treatments are really necessary. Negotiate billing when possible. This does make a difference. It's a hassle, yeah, but it makes a difference. Compare insurance plans. Now we're in open enrollment period for people on Medicare, and in November 1st, starting November 1st, for people on Obamacare plans. Look beyond the premiums. Examine the deductibles, the out-of-pocket maximums, the networks, the copay. Sometimes a slightly higher premium is worth it. Other times, a lower premium if you want to absorb some of the cost downstream. But we are in open enrollment, so take a look. Budget. Budget for wellness. Budget in yourself. Devote part of it to nutrition, fitness. It will pay for itself in spades going forward. You know, I ask myself, why do subsidies exist? It's the root of the shutdown right now at the government level. And you know, these unaddressed costs that are at the root of the problem and why legislation is continuously passed, all it does is drive inflation, drive the debt, drive the deficit, and make care more and more unaffordable. So we first have to act as the steward of our own health and shift from a passive recipient, oh, there's nothing I can do, to a proactive investor in our own self. Next, strengthen the knowledge of of the system itself. No, you don't have to know everything. There are a lot of resources within the system. But one of the unseen advantages as things collapse is how much you can learn and leverage if you choose to. You know, most people, I'd say most people, don't understand how programs like Medicare, Medicaid, private insurance really operate, which leaves anyone vulnerable to the hidden costs, surprises, and lack of control. Yet, if you take time to do this blueprint and you have it in hand, you can go forward and examine a few areas that are important to understand. Number one, coverage versus access. Just because you're covered, just because you have an insurance policy, does not mean you can afford all the care you'll need. Programs have networks. Insurance companies have networks. They have exclusions. They limit benefit structures in some area. Drug companies, drug plans, prescription drug health plans have formularies and different pricing. And many bills are driven by high drug cost. So the higher the tier in the formulary, the higher the cost, if the drug is covered at all. So ask about generics, ask about alternatives, and check before you just randomly accept paying $500 a month for that inhaler. Yes, that happened to me, and I took care of it. Billing quirks and out-of-network pitfalls is another one. Surprise bills arise when you go out of network, often not by choice, but by incident. Get unanticipated referrals and the services are not approved or unapproved because they're out of network. And these bills come in and they surprise everyone. So one of the things to pay attention to is there has been recent legislation on these surprise bills. Many states don't allow them. You know, you can't really consent to anesthesia with an out-of-network anesthesiologist when you're not conscious, right? It's nuts. So, in understanding how programs like the Affordable Care Act and Medicare are funded or underfunded, helps us see a little bit why subsidies keep growing and why relying on this overall system is risky and not sustainable. We spent national healthcare expenditures in 2023, 2 years ago, were $4.9 trillion, or almost 18% of GDP. The more you know, the less you are subject to surprise and the less helpless you feel. So reclaim your health is not only a personal, but a community value. You know, health is more than just the individual habits and clinic visits. It's a community activity. When you connect with others and embed this within our communities, we invest, all of us, in something bigger than ourselves. And the returns are substantial. It's one of the reasons I do what I do, make these videos, host a TV program, publish books, run support groups, and starting in January, running retreats for caregivers who are so burnt out. Not just family caregivers, professional caregivers. So look into your community and find out what's available. All healthcare is local. I really believe that. Walking groups, community gardens, cooking clubs, shared meals, shared movement, shared accountability. This helps to keep us kind of focused and committed. At least it does me. If you can, support others, especially if you've been down that road. Look into your community and see what groups exist. They are in every community. And if you don't know, just make some phone calls and you'll be able to get to it. And reframe your own health as social capital, if you will. Recognize that your choices are influenced by people around you, and your healthy habits do ripple outward. So thank you for taking time to look at this. The way we're going to change things is not going to happen from the top down. It's going to happen from the bottom up. And it's going to start with each one of us looking inside ourselves and asking, How do I reclaim my health?